My name's Sydney. I'll be your nurse today. First thing I'm going to do is close the curtain for privacy. Can you tell me your name and your date of birth?
Michaela Graham, 12/20/06.
Okay, now I'm going to check and make sure this matches. And it does, so I do have the right patient. Now I'm going to wash my hands. And I am going to let you know that this is confidential and you do have the right to refuse.
Okay.
Can you tell me where you are and what the date is?
The hospital. And today is September 9th, 2025.
Okay, so she is AAO times 3 and she does know where she is in her situation. So the first thing we're going to do is we're going to look at your eyes. I'm going to measure your pupils. They are 6 millimeters bilaterally. Now we're going to test your eyes. Okay, pupil constricted, constricted. Okay, so both pupils did constrict. And now can you follow my pen with the knot without moving your head? Okay, so eyes are accommodated. And they did follow, so they're perla bilaterally. Okay, your ears are aligned with your outer canthus of your eye. And take a quick look in your ears. No drainage, no lumps, no lesions. She has 2 piercings on each ear with only 1 earring in them. They are adequate for her skin color. Now we're going to check your nose. So if you could look up, it is midline, pink and moist, and terminates are present or visible. Okay, now we're going to check your mouth. If you could open up. Okay, uvula is present. Buccal is pink and moist. Can you lift your tongue up for me? No bleeding, no lumps, no lesions. Okay, can you stick your tongue out? Okay, tongue is midline, pink and moist. Can you say ah? Okay, phonation, it does raise. Okay, mouth is adequate for skin color. Now I'm going to look at your neck. It is symmetrical on both sides and it is adequate for skin color. Now we're going to watch for pulsations. No pulsations bilaterally. Now we're going to palpate for carotid pulse. Okay, graded 2+ bilaterally. And now we're going to listen for any bruits. Okay, can you hold your breath? And breathe out. And breathe in. And breathe out. Okay, no bruise present, and I did test that with my bell. Now we're going to do your posterior. So first we're just gonna open up your gown. Right there. Okay, now we're going to first see that it's symmetrical. Everything looks adequate for skin color. No lumps, no lesions, no moles, no marks. Everything's good. Now, first thing we're gonna do is palpate. We're gonna feel. And I'm doing this in a lateral way. Okay. Her posterior and lateral feels symmetrical bilaterally. Take a deep breath in and out, 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 in and out. And we're also doing this in a lateral position or lateral position. Breathe in and out. Breathe in and out. Okay, so auscultations sound clear, breath is unlabored and even all throughout her back. Now we're going to test for CVA tenderness. So just tell me, this causes you any pain?
No.
Okay, no CVA tenderness, which is great. And now we're going to move on to her anterior side. So first we're going to look adequate for skin color. Her back was adequate for skin color. I can't remember if I said that, but both are adequate. And then appropriate, not adequate. And Now we're gonna also take, okay, and a lighter sound. Okay, I think that was a little extra on my end. I don't think we're supposed to do that. But now we're gonna check your atrial pulse, pulmonary pulse, all that. Okay. Breathe in. And out. Pulmonary. Tricuspid. Mitral. Okay. Now we're gonna palpate for atrial pulse. Okay. Now we're gonna test it. Or get that pulse, sorry. And all those pulses, 2 plus, all the way across.
Sorry. No, you're okay. And what's the lowest line that you can read? E, T, O, D, C, F, O. Okay, and then can you read the line below it? D, P, C, Z, L, F, T. Okay, and then with both eyes covered, can you start, or what line can you start at? E, T, O, D, C, F, O. Okay, and then the line below it. D, P, C, Z, L, F, T. Okay, and then we can go back into the room. And observing your gait.
Okay, your atrial pulse is 72. Now I'm going to listen to all those with my bell. Okay. Atrial, sounds good. Pulmonary, pulmonic, sounds good. Tricuspid. And mitral. Okay. No S3 or S4 heard or murmurs or abnormal findings. Now we're going to look at your arms. Okay. So first I'm going to get your brachial pulse. Okay, 2 plus bilaterally. Now your radial pulse. 2 plus bilaterally. Okay, now we're going to test your capillary refill in both your hands. Okay, all capillary refills are less than 2 seconds. And now we're going to test your range of motion. So if you could, do this right here. Now do your wrist up and down and then around. Full range of motion in your wrist. Okay, now put your hands up, spread your fingers out. Do this right here. Now can you grab my fingers? Okay, full range of motion in your fingers. Okay, your elbows, do this again. Bring them towards you, back out. Okay, now to test your that, can you pull towards you? Okay, now push against me. Okay, muscle strength in your elbows is 5 out of 5. Wrists, 5 out of 5. Okay, shoulders, can you do this right here? Away from you, up to the top, down, and together. Okay, shoulders have full range of motion. Can you push up? Okay, strength, 5 out of 5. That's it for your arms. Okay, now can you lay down for me? Okay, now we're going to have to expose you a little bit to test your abdomen, if that's okay. So the first thing I'm going to do is notice that she is flat. She has a flat abdomen, no abnormal signs, adequate for her skin color. I don't see any abnormal anything. And First, we're just going to listen to all 4 of our quadrants, starting with the right lower quadrant and going clockwise. Okay, that is normoactive. Now we're going to lightly palpate, starting the right lower and then going clockwise. And they should not feel any pain normally during this. And then we're going to deeply palpate, 5 to 8 centimeters, starting right lower, going clockwise. Tell me if you feel any pain during this.
No pain.
Okay, good. And then do you want your femoral pulse tested?
No.
Okay, if I were to test it, I would take my right and middle fingers and test them, and it would be 2+. And also, would you like your gag reflex tested?
No thanks.
Okay, but if I were to do that, I'd take my tongue depressor, put it to the back of her mouth. If she gagged, that would be normal. If she did not gag, we would look further into that. Okay, that's all for your abdomen. And then we are going to keep that rolled up, and now we're going to move on to your legs. So, legs have no abnormal hair follicles, adequate for skin. Temperature equal bilaterally, or it's warm. And then we're going to test for edema. No edemas in either legs, and there's no pitting. Now we're going to to get her popliteal pulses. They are 2+ bilaterally. Now her tibial femoralis 2+, and then dorsal pedalis 2+ bilaterally. And then can you spread your toes for me? Okay. No lumps, lesions between the toes. Can you? Okay. No any wounds on the soles of the feet. Okay, now we're gonna check your capillary refill on your toes. Okay, all less than 2 seconds, which is perfectly normal. Okay, now, can you take your hip and do it out like this? Okay, other one, full range of motion in your hips. Can you take your legs and pull them up to your chest? Okay, now we're gonna test your strength. Can you push against me? Okay, now pull towards you. Okay, strength is 5 out of 5. And then, for your feet, can you point them towards me? Now pull them back up towards yourself. Okay, now push towards me. Okay, pull towards you. Okay, ankle strength is 5 out of 5. Okay, that's it. Now if you can stand up, and we're gonna test your knee range of motion. So can you do this right here? Okay, full knee range of motion. Can you do this right here? Now pulling forward. Now go side to side. Full spinal range of motion. And now we're going to test for your scoliosis. So if you could bend over. Okay, shoulders and hips are equal bilaterally. No scoliosis, so that's negative. Okay, you can stand back up. Now we're going to take you to get your eyes examined at the Snellen chart. And I'm going to assess her gait as she walks. Gait's normal, no problems. Okay, can you cover up your right eye and read the smallest line that you can?
LDOZOTE.
Okay, now cover your left eye. Read the smallest one you can read.
LDCZOTE.
Okay, now uncover both and read your smallest line.
LDCZOTE.
Okay, your right and left lines are 20/20. And you can come back in. So I think that's everything, and you are normal.